Do you know that over 30 million people suffer from diabetes in the US, out of which about 7 million are undiagnosed? There are obvious signs, but there are some unsuspecting signs and symptoms that may not catch your attention. Today, we will be talking about some unusual signs of diabetes that you should be aware of. Let's begin. Number 12. Darker skin on the neck. The development of dark patches in areas such as the neck, armpits, elbows, and knees is often mistaken for skin disease, but is actually a skin pigmentation issue that can be a sign of prediabetes. Acanthosis, or dark skin pigmentation, is a notable indicator of untreated high blood sugar. These patches of skin are thick and velvety to the touch and may cause itching. The primary cause of this skin condition is an excess of insulin in the bloodstream, which prompts rapid reproduction of skin cells. However, this condition can be reversed by adopting a healthy diet, engaging in regular exercise, and utilizing methods to control blood sugar. Number 11. Dizziness. Lightheadedness, or dizziness, is a common symptom for a plethora of health conditions. When blood sugar levels increase, the body attempts to remove excess glucose by increasing urination. However, this process can lead to reduced fluid levels in the body, causing lightheadedness as the brain struggles to function properly. Number 10. Vision problems. Elevated blood sugar levels are associated with a range of eye problems, such as blurry vision, cataracts, and glaucoma. When blood sugar spikes, the lenses of the eyes can swell, resulting in blurry vision. Fortunately, these vision issues can typically be resolved within a few months with the appropriate medication and blood sugar management. In addition to these better-known problems, diabetes can also cause lesser-known vision-related issues, including eye pain, seeing halos around lights, experiencing headaches, and watery eyes. Number 9. Recurrent infection. Individuals with high blood sugar levels are more vulnerable to infections such as flu and pneumonia. Additionally, they have an increased risk of developing infections in the ear, urinary tract, sinuses, and nose, as the excess glucose in the body impairs the immune system's ability to produce infection-fighting white blood cells. In more severe cases of diabetes, the buildup of blood vessels can also affect blood flow, reducing the body's capacity to heal wounds. Number 8. Unexplained weight loss. Unintentional weight loss is typically a sign of an underlying medical condition and can be caused by various factors such as diabetes, cancer, Addison's disease, tuberculosis, or other ailments. When weight loss is triggered by diabetes, the body is unable to extract glucose from the blood cells and use it as energy due to insufficient insulin. Consequently, the body resorts to burning fat and muscles, which causes a significant reduction in weight. Number 7. Irritability and mood swings. Blood sugar level changes can have a direct impact on an individual's mood and mental state, with these symptoms subsiding once the blood sugar returns to normal range. Fluctuating blood glucose can lead to rapid changes in mood, with low blood sugar levels possibly resulting in confusion and even epileptic episodes. Diabetes can also contribute to the development of depression, anxiety, and stress, which can negatively impact an individual's quality of life. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all our great Bestie content. Number 6. Nausea. Nausea can be triggered by several factors, like medication, gastroparesis, and pancreatitis. However, one of the most overlooked factors is diabetes. Both low and high blood sugar can cause nausea. If these symptoms are worsening, it can result in several health complications, including insulin shock. To avoid these complications, it is important to follow a strict meal plan, closely monitor blood sugar, and indulge in various outdoor activities. Number 5. Dry mouth. Dry mouth is a condition in which an individual's mouth lacks sufficient moisture, as the name suggests. Saliva plays an important role in controlling bacteria levels and washing away the acid present around the teeth and gums. If you find you're reaching for water more than usual, you may be experiencing xerostomia, the clinical term for dry mouth. Irritation in the corner of the mouth and inflammation of gums or gingivitis are some common symptoms for dry mouth. Although this condition can happen to anyone, it is most common among people with type 1 and type 2 diabetes. Number 4. Dry, itchy skin. Did you know that diabetes can lead to nerve damage, which can lead to dry and itchy skin? If you have diabetes and are developing dry, irritated, and itchy skin in a specific area, it may increase the risk of developing a skin infection. But what causes irritated skin in people with high blood sugar levels? Before nerve damage caused by diabetes, levels of cytokines in the blood increase, leading to inflammation, particularly around the hands and feet. Since these substances are inflammatory, they can cause persistent itching. You may find some relief by avoiding hot baths and using gentle, non-irritating moisturizers, particularly between the fingers and toes. Number 3. Pain in limbs. Pain and cramps in the limbs are often overlooked, but if you have high blood sugar, it can be cause for concern. Diabetic neuropathy is a condition that occurs when the nerves are damaged due to uncontrolled or chronically high blood sugar levels. This neuropathy can lead to leg pain, cramps, numbness, tingling, burning sensations, and other discomfort. Number 2. Gum disease and bad breath. Although plaque and poor dental hygiene are the main culprits of halitosis, also known as bad breath, diabetes should not be overlooked. If you have noticed a change in your breath lately, it is important to get your blood sugar levels checked. Elevated blood sugar levels result in high levels of glucose in the saliva, providing a feast for bacteria in the mouth and in between teeth. Moreover, high blood sugar compromises the body's ability to fight off infections, making it harder to combat worsening gum disease that may lead to bad breath. Number 1. Chest pain. Chest pain is a symptom that should not be ignored and can be caused by various medical conditions. In some cases, high blood sugar can lead to cardiovascular disease, which may cause chest pain. This can be due to the buildup of plaque in the arteries, which can reduce blood flow to the heart and cause angina. If you experience chest pain, it's important to seek medical attention. It is said time and again not to ignore the signs of high blood glucose. Doing so may impair normal functioning of organs. We have a few videos on managing diabetes. Watch 14 Signs Your Blood Sugar is High and Diabetes Symptoms, or 11 Healthiest Breakfast Foods Every Diabetic Must Eat. Go ahead and watch one or both videos if you want to learn how to manage blood sugar and diabetes. How do you deal with high blood sugar? Sound off in the comments.